Right, and you're good to go.
Hi, my name is Anaya, and I'm here with Layu and Abby, and we're going to be discussing breathing emergencies. The other day, I was at a restaurant, and the person next to me was gagging. She was panicking and clenching her throat. She was choking and couldn't breathe. Soon, she passed out, and I had no idea what to do. And the only thing I could think about is what would happen next. What happens next is knowing what a breathing emergency is and gaining the knowledge and insight of how to respond to it, because no one should ever be put in a position where they don't know how to save somebody because of the lack of access to information. Breathing emergencies result from being unable to consume the required amount of oxygen from aerobic respiration, which requires a certain level of blood oxygen. Breathing emergencies can be caused by choking, allergic reactions, asthma, respiratory infections, chronic pulmonary disease, heart disease, or heart failure, and due to other scenarios.
What's considered normal breathing depends on the age of the patient. For adults, the average breathing rate is 12 to 20 breaths per minute. Anything above or below that is considered abnormal.
And as you can see by the data above, from when a baby is born until they become an adult, the breathing rate decreases by a large amount. The reason why younger children and babies especially have to breathe more often is because they have smaller lungs and muscles. It's also important to note that a child's lungs are not fully developed until the age of 2 or even 5 years old.
Here are some common symptoms of choking and breathing emergencies. The most common sign of choking is if someone is clutching their throat and having difficulty breathing and talking. Patients may also turn blue or pale due to the lack of oxygen.
Depending on if there are multiple bystanders, have someone call 911, and if the patient is conscious, try to have the patient cough out whatever's choking him. If the patient can't cough it out, perform the 5 to 5 method. And if the patient is unconscious, perform CPR instead until the 911 responders arrive to take care of them.
So the 5 and 5 method is actually pretty simple. You want to deliver 5 back blows and 5 abdominal thrusts, which is also known as the Heimlich Maneuver. You just want to alternate between the two until the blockage is dislodged. So to perform a back blow, stand to the side just behind the choking adult, and then for a child, you want to kneel down behind. And then you want to place one hand across the person's chest for support and bend the person over at the waist. Then deliver 5 separate back blows between the person's shoulder blades with the heel of your hand. To perform the Heimlich maneuver, stand behind the person and place one foot slightly in front of the other for balance. Wrap your hands around the waist and tip the person forward slightly and make a fist with one hand. Grasp the fist with the other hand and press hard into the abdomen with a quick upward thrust as if trying to lift the person up. Perform between 5 abdominal thrusts until the blockage is dislodged.
For infants, the 5 to 5 method is done while laying the infant on the rescuer's forearm and using the palm for the back and 2 fingers for the front.
You want to keep in mind if you're the only rescuer available to the patient and they're unable to remove the item from choking or coughing, perform the 5 and 5 method before calling 911.
The cardiopulmonary resuscitation, also known as CPR, is a life-saving technique useful in many emergencies, including a heart attack or near drowning, in which someone's breathing or heartbeat has stopped. In the case of our scenario of a breathing emergency by obstruction of the airway, we would perform CPR if the person became unconscious while performing the 5 and 5 method. One other situation where CPR would be needed is the scenario if the patient still remained not breathing despite the obstruction removal. To perform CPR, first place the patient on a flat surface, usually the floor, and place the heel of one hand in the lower half of the sternum in the middle of the chest and put the other hand on top of the fist. Straighten your arm and push down for at least 2 inches, but no more than 2.4 inches at a rate of at least 120 compressions per minute, pausing every 30 compressions to deliver rescue breaths by opening the airway using the head tilt chin lift maneuver exemplified in the diagram on the right. Give one rescue breath lasting 1 second while watching to see if their chest rises. If the chest rises, give another rescue breath. If the chest doesn't rise, repeat the head tilt chin lift maneuver and then give a second breath. Continue the cycle until the patient shows sign of movement or until 911 responders arrive.
Infant CPR is performed in a slightly different manner, using 2 fingers, less steps, and more precision with the rescue breath. The key to take away from here is to remember the symptoms to look for and call 911 before doing 5-to-5 method and CPR if needed.
And here are our sources, and thank you for listening to our presentation.